The Ministry of Health says it has heightened surveillance and continues to assess developments surrounding the outbreak, amid concerns over the potential spread of the virus through international travel. National epidemiologist Dr. Michel Francois says Saint Lucia remains on alert as regional and international health agencies continue investigations into the situation.
The Ministry of Health, Wellness and Nutrition is closely monitoring reports of a cluster of hantavirus cases linked to the cruise vessel, the MV Hondias, which departed Argentina on April 1, 2026, carrying passengers and crew from 28 countries. The outbreak on the vessel has resulted in 9 reported cases of hantavirus, including 3 deaths as of May 11, 2026. 5 of the 9 reported cases have been laboratory confirmed. Efforts are ongoing to ensure affected individuals receive appropriate medical care and to prevent further spread of the virus. At present, Saint Lucia is considered to be at low risk for the hantavirus transmission.
Health officials say a Caribbean national who was on board the vessel may have been exposed to the virus, although authorities in that country have so far reported no confirmed or suspected infections.
However, official communication from the relevant country has indicated that there are currently no suspected or confirmed cases of hantavirus there at this time.
International health authorities have warned that additional cases could still emerge in the coming weeks due to the virus's incubation period.
The World Health Organization, WHO, has assessed the overall public health risk as low, and given that the incubation period for hantavirus can extend up to 6 weeks, additional cases may still be identified as investigations continue.
The epidemiologist further outlined the symptoms and dangers associated with the virus, noting that early medical attention remains critical in preventing serious complications.
Hantavirus is not a new virus, and over 20 strains have been identified. Transmission to humans is primarily through contact with the urine, droppings, or saliva of infected rodents. There is limited spread from one person to another, and this has only been documented with the Andes virus, which is the strain associated with the outbreak. Such spread is generally linked to close and prolonged contact with an infected person. Symptoms of the hantavirus may include fever, headache, muscle aches, abdominal pain, nausea, and vomiting. In severe cases, the illness can progress rapidly to coughing, shortness of breath, fluid accumulation in the lungs, and shock.
Dr. Francois also advised travelers and members of the public to maintain proper hygiene practices, avoid contact with rodents, and remain cautious while traveling abroad, particularly in areas where outbreaks have been reported.
Individuals traveling to areas with ongoing transmission are advised to avoid rodent-infested areas where possible. When cleaning areas contaminated by rodents, individuals should use appropriate protective measures, including face masks, gloves, and disinfectants, to reduce the risk of exposure to airborne particles that may carry the virus.
While urging vigilance, Dr. Francois reassured the public that there are currently no confirmed cases of hantavirus in Saint Lucia, and says health officials remain prepared to respond should the situation change.
At this time, there are no suspected or confirmed cases of hantavirus in Saint Lucia. The Ministry of Health will continue to monitor the developments related to this outbreak and provide updates to the public.
I'm Christabel Obi reporting for Hot 7 TV News.